Hi, good afternoon, everyone. This is Courtney Kesterson, the Disaster Preparedness Program Coordinator. And then with us here we have Jason Belden as well.
Good afternoon, everybody. Jason Belden, Disaster Preparedness Program Manager with CAF.
So if you've joined us before, you'll know that this is the Disaster Resource Center Update webinar series. This program is for LA County skilled nursing facility providers, and we cover emergency preparedness topics and current events for LA County Department of Health Services and EMS. And if I could just get it started, there it is. Okay, so here we've already done our introductions, and then Rich Witterinski might join us later. He is our liaison to the Disaster Resource Centers, and he attends a lot of the meetings. You may have met him or seen him speaking there. And this slide here is from one of our earliest webinars, kind of just revisiting our mission. So what we do with Rich attending all of the Disaster Resource Center meetings, and then Jason or myself attending the other county exercise or Disaster Coalition Council meetings, we kind of collate all this information for the long-term care providers into this webinar series. And then eventually, and we want to start pushing for this more to actually create a network where each provider has connections with other buildings in the event that you need to evacuate, and really start building on that mutual aid that kind of the rest of the county coalition builds amongst themselves. And we've kind of had some challenges in integrating with them there, so we want to really remind everyone that we want to kind of network amongst ourselves as well when putting together our emergency operations plans. And then that last bullet there, we bring tools to help you accomplish all this. So I added some new acronyms to this slide here that we're going to be discussing later. In the later slides, I did try and spell them out as much as possible, so don't feel like you need to memorize these. At this second, we'll go over them again later. And those last three bullets, the MAC, OEM, and DOC, those are the new acronyms that I am talking about, and we'll go into detail on that. So we put this picture in each webinar just to kind of remind everyone the scale of what we're looking at when we talk about building a coalition and building these memorandums of understanding. In LA County, there's about 10 times as many SNFs that we see in other counties, in smaller counties, and so it's a much bigger operation. But you also have 10 times as many potential partners for planning together, exercising together, and moving your patients or your residents around in case there was a large regional or countywide disaster. You may be familiar with your local disaster resource center, and here's just another picture to illustrate kind of how they're spread across the county. And then here's the timeline for our upcoming events as far as before our next webinar. These are kind of the things that you need to have coming up in your calendar. And first and foremost, it's highlighted in red there. Make sure that you register for the exercise by October 31st. And the link for that can actually be found in the agenda for handouts. So I should have probably started with that, but under today's handouts, we have an agenda with some important links, and then a list of the upcoming tabletop exercises at the disaster resource centers as well. And so again, just make sure that you register for that. And if you don't get your registration in before October 31st, then the county won't be able to give you the certificate of participation. And they said in their last meeting that if anyone emails them after the 31st, begging and pleading to be let in, the answer will still be no. So please take advantage of that now. We still have an entire month. So, and then hopefully you all already have November 21st on your calendar for the exercise, and we'll be reviewing the county's kind of timeline for the exercise today. So that's one of our other handouts, is the county's, it's called a MSEL or MSEL, and that stands for the Master Scenario Events List. We're going to go through that line by line and look at what is expected of long-term care. And then lastly, we'll have another webinar before December. Our next webinar is going to be November 6th, but these are kind of the wrap-up events for this exercise. So in December, the county gets together and they review at a county level all the different provider types and what challenges they had, and then they put that all together in a county level after action report. And then for your own after action reports at your facility, you're expected to send those to your Disaster Resource Center by January 22nd.
So I just want to mention, this is Jason Belton. I just want to mention for you guys, if you plan on using the statewide or the Los Angeles County Medical Health Exercise to meet those CMS requirements, you must pre-register by October 31st because they're not going to give you that proof unless you have pre-registered, and that proof is going to help you in your survey. And then at the end there where you see January 22nd, you guys, in order to get this, a part of making this count towards the CMS requirements is producing your own after action report with an improvement plan. So after you finish the exercise, and we're going to talk about, how to do that at your building and all that in a second, but once you finish, that after action report needs to be kept for your records as proof that you did the full exercised, and you looked at the after action report and improvement plan, but also a copy of that after action report that you do for your own records and for survey that needs to go back to the county so they can see what providers are struggling with, and they can think about risk like mitigation strategies or maybe pre-staging resources or whatever. It's all going to be dependent on what you guys have identified as issues that you would have during this type of event.
Thank you. Okay, so moving on to our next slide. So you may have seen this slide before. This is kind of the annual cycle of how the emergency management continuum kind of works for the coalitions. So we're moving in closer to November and we're gearing up for the full scale or the community-based exercise. And then again, here is just a screenshot of the flyer that was sent out with all of these dates kind of leading up to that. So if anyone attended the September 24th participant seminar last week, or if you didn't, I know that we only had about 40 seats available through the county's Eventbrite. So we wanted to put this webinar together so that everyone kind of got a chance to see the documents that were discussed and kind of get a quick overview of everything that happened during the morning session, which is when long-term care we're supposed to attend. So we had some presentations from the LA County Office of Emergency Management and the Department of Public Works, and they just gave an overview of how kind of the Office of Emergency Management works with the Department of Health Services, how they support kind of their planning and exercising efforts, and then somebody from the disaster management area coordinators team gave a presentation about how if you are in a disaster management area, then you have extra resources for running an exercise. And then if you are looking to do a full-scale exercise at your facility, that might be worth reaching out to. And that's kind of an entirely different system and different areas. The county's broken up into different areas for the disaster management areas than from the disaster resource centers. So this is kind of another layer that we haven't really talked about too much because the Office of Emergency Management, they're kind of who all of the public health people report up to. So we've talked a lot about just the public health stuff, and now this is kind of an extra layer. I don't know if it'll kind of impact our exercise too much, but it was kind of just an educational overview for some of the people there at the seminar. And then
and I'll break it down to some real easy takeaways from what you guys need to know about how the process works. On the next slide, we'll talk about kind of how we work within that system and what Los Angeles County wants us to do. But I'll give you an example. So once we get to the next slide.
Okay. Next slide. So here's just kind of a summary of that. So LA County responds to the LA.
Yeah, so the Los Angeles County expects the long-term care providers to send their medical requests to the Medical Alert Center. And so the Medical Alert Center is essentially, uh, EMS and Department of Healthcare Services. That's their first line of managing the event. Um, their plan is to have you guys do these requests through ReadyNet. Not everybody in the county is on ReadyNet, and most of the people in the county that are on ReadyNet are not real comfortable with working that process. But ideally, that's the way medical requests need to go. And so, what's an example of a medical request? Let's say you're sheltered in your building. And you're running out of insulin, or you're running out of, or you don't have an oxygen concentrator, or it's some other medical request that you need to support safe operations in your building. That's when you would reach out to the Medical Alert Center or ReadyNet, or through ReadyNet, and send that request to the Medical Alert Center. Now, if you're sheltered in place and you run out of diesel fuel for your generator, then you're going to pass that request along to your city's emergency operations center. If you look at that last bullet point, I know there's a lot of information in there. If you send a request to the MAC, your request is probably going to get met, but there's going to be a delay because they have to take your request and then send it over to the emergency operations center. Now, this is how Los Angeles County works. If you come from a different county into LA, it's a little bit different in every county, but most counties, they're at the county level, they do everything in one. And this one, because Los Angeles is so big that, let's say you're in the city of Long Beach, you could have a large event and it never expands upon or never exceeds the borders of the city of Long Beach. And so Long Beach would manage that event completely by itself. They would not even, the Medical Alert Center would be activated, but only for medical health requests. The local emergency operations center at Long Beach would handle all those other requests. So if you think about it in this terms, medical stuff goes to the Medical Alert Center. All other non-medical stuff, you would make those requests to the Emergency Operations Center for your local city. Now, because LA, I don't know how many cities there are in LA. I don't know, hundreds?
88.
88? Okay. So not every city is going to have an Emergency Operations Center. Most of them do, but some of them share that with other cities close to them. For the most part, though, you can think about if you're in a larger city, you're going to pass those requests directly to the city. If you don't have that information in your plan now, and now's the time to do some research and find out, okay, for my city, what city am I in? I'm in the city of Torrance. Okay, I'm gonna do a Google search, City of Torrance, Emergency Operations Center, and look for duty officer line or something like that. And that's kind of how we would address this particular issue. I'm not saying that you shouldn't make those requests to the Medical Alert Center, but I'm saying that there may be a quicker way to fulfill those requests by going directly through your city's Emergency Operations Center. And I think that's pretty much what they said at the provider conference. They just can't guarantee that if you send it to the MAC, that you'll get a quick response because they don't have those resources sitting around in a warehouse. They're going to have to coordinate with somebody else to get it to you. So,
yeah. Yeah, and I think that is said on here is it's important to know this because if you have a non-medical request, by sending it through the medical alert system, it's supposed to eventually get to where it needs to go, but if you know that, non-medical needs to go to the city and then medical alerts can go to the county's medical alert center or the MAC, then you should get a faster response to your non-medical requests like generator fuel,
right,
or transportation for staff.
And this is if you really want, if you guys are really, oh man, this is new information. I want to test this information to see how well we would do that. If there are a few cities that are participating in the LA County exercise, I know the city of Long Beach is doing it, and I'll have to look to see who else, what other cities are doing it. But you could practice this because those cities are also going to be exercising on the same day. So you could figure out what the process is for sending those resource requests over, and then incorporate that into your exercise. That's kind of advanced level stuff at this point if you wanted to make an addition to your response, but you could do it. If you want to practice it, the ability will be there if you're in one of those cities. If you have questions about that, reach out to me and I'll get a list of the cities that are participating. I think it's only 2 or 3. It's the big, large cities within the counties.
Right. Okay, so this is the next section of our webinar. So we're going to review the document that was handed out at the September 24th participant seminar. And that's going to be the LA County Meisel or Master Scenario of Events list. And you can find this under handouts. I also tried to send it out earlier before the webinar, so hopefully that got out. But if you don't have it yet, you can find it under handouts right now. So for the exercise, there were some objectives that were created by Jason, actually. He sits on the exercise committee. And so along with the hospitals and the dialysis and all of the different provider types, they get together and they come up with the scenario, and then they come up with the different tasks for each type of provider. So right now we have objective number 1 pulled up, and so if you're looking at the document, this is word for word. I just copied and pasted out here, so you can follow along on the document or you can follow along here. But our first objective for participating in the exercise is going to be activating your plan. So the scenario for this year is flooding, and so you can kind of decide how you want to create this exercise so that it will challenge your facility and your emergency operations plan. And we kind of leave this open-ended for you to customize because you know whether or not your facility is geographically in an area that might be prone to flooding, or maybe you're up on a hill and you might prefer to kind of play as if you're going to be offering assistance to another building. So that's kind of up to you, but this is kind of where you decide to activate your emergency operations plan. You would begin the exercise. You would identify any staffing needs. So part of the flood scenario is that the flooding is going to make it really hard for your staff to get into work. So this is kind of identifying those first few challenges and then activating things like your emergency staffing.
Yeah, and I'll just a word on objectives and why we do that real quick. The federal government has these things, these kind of targeted capabilities that they want us as healthcare providers to kind of target to prepare ourselves and be better prepared. And the objectives are written in order to test those capabilities. The very first one is just basic stuff. If you know, and Courtney's absolutely right. If you've got, if flooding is not, it's not appropriate for your building. You sit on a hill and, in some area that's not subject to land subsidence or something like that. But you determine, external flooding is probably not a risk for you. Then what I would say is we've got enough for you guys to participate in this exercise. You just have to practice the shelter in place portion of the exercise rather than the evacuation portion. If you're in a flood zone, you can do the shelter in place portion if you want to and just pretend the flooding is somewhere else. That's completely up to you to determine what you think is the most important thing. But when we talk about this one, what does it mean to activate your emergency operations plan? It just means that creating an incident action plan, figuring out what you're going to do, writing down objectives that you need to meet within your building. So what are the things that we would need to meet in our building during an activation? Well, the first objective should be to protect the life and safety of the residents and the staff. And so when we talk about that being your objective in your incident action plan, when you're going through the event, think about the procedures that you will need to do. Hopefully they're listed out in your flood policy and procedure. If you don't have a flood policy and procedure and you need one, email us. We can get you one. If you're just doing shelter in place or evacuation, that's when you need to grab those policies and procedures and use that to dictate what your simulated response is going to be. So,
let's see. So here we have kind of, I think we showed this on our last webinar, but this is the flowchart of kind of that activation. So you'll see that dark purple box, it says incident or disaster occurs. So besides activating your emergency operations plan, probably the next thing you want to do is log on to ReadyNet and check and see if there are any sort of status polls going on, because as soon as there is sort of this disaster or emergency declared, the county is going to want to start receiving information from you about your operation status. Are you okay? Do you need assistance? Would you be able to accept residents that need to be transferred from somewhere else? And then this also addresses whether or not you need resources. So if you do need resources, you would submit a resource request. And then if you do not, then you could just respond to the ReadyNet polls that you are currently operationally green or doing fine.
right. Yeah, I would, that ReadyNet stuff, guys, the bed polling thing, figure that out before the exercise. Don't wait till the exercise, because we're not getting a lot of participation when we're doing the what they call the service polls. They should be sending out a notification to the email address of the person that signed up for ReadyNet as the contact, and it sends out an email that says, "Can you log into ReadyNet and send us your service level?" And that just means that what is your facility's ability to assist? Are you currently operational and you can take people? Are you currently operational but you're closed? You can't take anybody? Are you currently operational with some impacts, and then are you non-operational? I think there's like 4 categories. It's multiple choice. It takes literally like 15 seconds to answer log into the account and click one button and you answered the ReadyNet service level poll. That poll will go out the morning of the exercise, and this is going to be good practice for you guys to answer that information during the poll. So.
It's not only going to be good practice, but the county wants to see some participation because they've run a few polls, kind of no notice drills, and out of almost like 200 or 300 SNFs that have signed up for ReadyNet, maybe one person writes back.
Yeah.
And so
I don't want to give people a hard time about not doing it, but it's really like, I'll give you an example. When we do it in other counties, for other counties communication platforms, we usually get 70 or 80% response, something like that. Sometimes better, sometimes worse. But if one party out of 250 people do it, it's beyond not good. I don't know what to say, but we need to do better at it. And so if you guys that are listening to the webinar are on ReadyNet, please go in and confirm that you know the login information, that your email address is correct in there, and that you will be the one getting the notification. That's the first thing we can do, that just at least confirm that you're going to be getting the information on the day of the exercise.
Right, and I think they might actually send out a couple polls looking at, when we look at the Meisel and the spreadsheet and a couple slides, we'll see that I think they're actually going to send out a couple polls, so you'll have maybe more than one chance to participate on that.
Yeah, and look through your junk email folder, make sure the ReadyNet emails aren't getting dumped in there. That would suck if there was a real event and your ReadyNet emails are all going down your junk email. Thanks.
Yeah, and not only that, but when we participate more, then it shows to the county that we're engaged, and if nobody participates, then I don't want them taking away the ReadyNet thing. So, but anyway, moving on. So we kind of already talked about the Medical Alert Center. It is part of the Department of Health Services, and it also is kind of where the EMS agency and health services work together. And then when you report something on ReadyNet, it goes to the MAC. That's who's on the other side of ReadyNet there. And they are going to use it mainly for bed availability for SNFs and those operation statuses. MCI stands for mass casualty incident. That is more of a hospital thing.
Yeah, the second bullet and the fourth bullet are more have to do with hospitals, but obtain and communicate bed availability. That's critical in a large event to help kind of figure out what's going to happen. We sit around here and lose sleep over a large earthquake in Los Angeles County because we just know that there's going to be 30 or 40 facilities that are going to be impacted. And the only way for us to find places for even 5 facilities evacuating will be to do mass bed polling and figure this out, because your individual agreements with other providers are not going to be adequate to meet all the bed needs of these people evacuating. So that part is critical, but also letting the county know your status, whether they're going to have to come help you or whether you're going to be able to provide help for somebody else. So all good stuff.
Right. Okay, so moving on to our second objective. So again, this is the next part of that handout document, the LA County Meisel. And so this one is going to be your next task after activating your emergency operations plan and maybe identifying some staffing shortages or identifying some issues with flooding, kind of depending again on what you want to do and what you want to test. So the next step then is to gather, organize, and document the incident situation and document information, maintaining situational awareness, and then how are you going to continually share that information with other stakeholders. And by stakeholders, we mean everyone from, like ReadyNet and the MAC with the county partners, but that also can include the residents and the residents' families, as well as ongoing communication with your staff.
And state licensing too.
And licensing, right.
Yeah, so all of these things that we're talking about, you should actually physically be doing as a part of the exercise. So it's not knowing what to do. It's actually practicing how you would share that information. So we've talked about the ReadyNet and logging in and giving that service level information, but it's also what information are you going to share with licensing? When are you going to share it? And then what format are you going to use to share that? Are you going to fax them something? Are you going to call them? Who's going to call them? Have that assigned as a responsibility during the drill. Now, you're going to call the licensing district office and you're going to say, whatever it is you're practicing, and then obviously you're going to let them know it's a drill and not that, but practice the actual process of calling the district office so you know, do you have the right phone number in your communication plan? Is the phone number the number you should be calling to notify people? Or is it or is it a number for a supervisor or something like that? Get the right phone number. The practice how you're going to get information. What my suggestion would be is to do it without internet. Don't use the computers at your building to access information. That's what I would do. I would say, look, let's pretend the internet is down. How am I going to get information? Can I get it on my phone? Well, probably. If maybe the internet's down in your building, but your phone still gets internet. Things like that to kind of challenge the response within that. But you have to physically do these actions. It's not a talking about the action. It's actually somebody in your facility physically doing the functions that they would do during a disaster. So.
Right. No, that's all a good point. So again, activating all of your different communication plans, identifying who's going to actually be doing that, because you're not going to be able to manage all the communications by yourself. So
you're going to have to delegate that, and hopefully you're doing it with incident command, but maybe. Yeah.
Right. And so we have one more webinar before the actual exercise. So I just want to challenge everyone today, try and figure out who you're going to include in the exercise and then who you can start assigning some of these tasks to, so that, over the next month as we get closer, you can start kind of coaching up those people so that they know what's expected of them. And even if you're planning on doing the Great Shakeout in a couple weeks, that's a good time to practice some of this too. And maybe you do something for the Great Shakeout and that person doesn't want to be your communications person. You have time to switch it up before the November exercise. So again, this next month is really crucial in figuring out who those people are going to be. what shift you're going to be doing this exercise with. Are you going to need to bring in extra people while your assigned staff will be going through the motions of the exercise? All that logistical stuff. Now is the time to figure that out.
Yeah, and especially with the staffing issue, you're going to need to have a team of people doing this exercise. At least that's the way it's designed to do. So think, minimum 4 or 5 people to manage this incident. If you can do more, do more, but actually go through the physical motions of whatever you plan on doing. If this was an event you plan on sheltering in place, physically go through the motions of what it would be to shelter in place. And we'll talk about meeting that particular objective and the and the evacuation in a second, but pick your team. You've got to have a team. You've got to have somebody that's going to lead the exercise. You've got to have players or people that are going to do the work. And you've got to have somebody that's going to be an observer. It's called an evaluator, somebody that's going to sit on the side and is going to be a fly on the wall or a bird in a tree or whatever analogy you want to use. They're not going to communicate with anybody in the exercise. They're only going to review the actions that your staff are taking, and those notes that person's going to take are going to help inform the after action, but also the debrief that you do right after the incident. We'll talk about that in a second.
Yeah, and if you don't know who to ask to be your evaluator, if you have an established relationship with your DRC coordinator, those people, I mean, they're super busy, but they really know their stuff when it comes to that. So you could always ask if they might know someone that would make a good organizer or, observer.
Yeah, and I still think that it's important that whoever the exercise controller is or the leader of the exercise, if it was me and I was administrator, I would want to be the controller of the exercise, if only to see what my staff's performance would be during a disaster if I wasn't there. So that's another layer, and it makes it much more difficult because your assistant administrator or your DON or whoever you have tasked with being that second in command, it may take them by surprise, and that you may see some challenges. Or this person may be fantastic, and you may go, you know what, they should be the leader from now on, and we're going to make them the incident commander. I don't know, but I think it's a good idea to get a really good view of your building's performance because disasters don't always happen during the time that the administrator's in the building. So it's a good practice to get into.
Yep. Okay, our next objective. So this is one of 2 objectives that you can kind of choose between. So I think we already mentioned several times that with the exercise, kind of your first step is to look at what function you want to test, whether you want to practice sheltering in place or whether you want to practice evacuation. And then kind of inherent in either of those is activating your memorandums of understanding. So if you shelter in place, you might be receiving residents. So then you're kind of doing a little bit of a surge exercise there.
Yeah, and so most of you, I think all of you, you're required to have a shelter in place policy and procedure. That's required by CMS. Look at that. You're going to want to use that because that's what's going to dictate your actions. You can't do actions that are not, well, you can, that are not dictated in the plan, but you'd want to assess the actual written plan to see, are we doing all of these procedures the way our plan says we should? And are there procedures on here that aren't listed that we need to add? And especially if you're sheltering in place and you're planning on making yourself available for assistance and you may need to go over bed capacity, it could be things like, well, have we looked at schematically how we can fit resident beds in our dining room? How are we going to feed those folks? What's the schedule? Where are we going to send these folks to the bathroom? How are we going to do med pass? Well, how are we going to do an intake on these people so that they know where they are? Are the other buildings going to send us staff when they send us these residents? These are all a bunch of questions that you're going to have to ask and answer in order to shelter in place. one of the first objectives or one of the first kind of injects we gave during the scenario was that this had been a few days, a buildup to this event now, and that you're going to start off the event already at a deficit for your staffing. So we want you to understand that in this particular scenario, we're anticipating that you may have staff that cannot get to work. So if you're going to shelter in place, do you have enough staff? And if not, how do you get more staff? You would obviously test your staff recall procedures. But let's say you couldn't even get your own staff in there. Do you have contracts with a provider to provide temporary
Staffing?
temp staffing? If that will work, that's great. If that doesn't work, what's the process for requesting those medical staff from the MAC? And that's a part of one of those things you can do through ReadyNet is to request assistance with staffing. And if you'd want to be specific, if you need a respiratory therapist or you need a nurse or you need a doc, you have to be specific in what you want. But all of those things need to go into just shelter in place. And so when you look at your policies and procedures for shelter in place, you should be testing those as if you were literally sheltering and you were an island right now and you have to make do with what you got. And that last bullet point is identifying what resources you're going to need. Do you have enough in-house to last? How long will that last? How long until your lowest amount? So if you calculate resource needs and you go, I got 7 days worth of water, I've got 5 days worth of food, and I've got 2 days worth of diesel fuel. We know that we're probably okay on the food and water, but the diesel fuels concerns us. If this goes past 24 hours, we're going to start to have to call people to get refueled for our generator. So calculating those resource needs, when you're going to need them, and then use that situational awareness that we talked about to kind of anticipate how long you're going to have to go sheltered in place.
And just to add to that, that just reminded me of something they said at the participant seminar when they were talking about the resource requests. You need to give them, like 12 hours to process it and find the resource and then figure out a way to get it to you. So just like Jason was saying, if you know you have 48 hours worth of fuel, halfway into that, you need to be trying to find your next resource. And especially if you're gonna be counting on the county to help you with those, you need to give them as much heads up as possible, and that goes back to our last objective with that continuous communication. So, yeah. Okay. So then our next objective, so kind of the flip side of what Jason was just talking about, was evacuation. So if you decide to evacuate, then you would implement your policies and procedures for that. So under the CMS EP rule, there is a requirement to have an evacuation policy and procedure. And this is like a whole entire day training in itself. If you were able to attend our trainings, last year now, but
so the inverse goes for the evacuation. Mm-hmm. Obviously, all of the challenges you have to think about with evacuating a building. If you take a mental thought and you thought, right now, if I had to evacuate my building, what are all of the components that go into that? So it's seeking relocation sites. And so in your exercise, you're going to do the physical actions that you would do if you were looking for relocation sites. You're going to call your partners that you have MOUs with and say, this is a part of our drill. We're just practicing how many open beds do you have? Can we move residents there to you? If you've got another site, a sister facility that you're going to go surge into their facility, have all that stuff written out. Talk to your transportation providers. Find out how you're going to get these folks from point A to point B. Are you going to use your own transportation that you have contracts with, or are you going to call the county and ask them for assistance with evacuation? It's up to you. That's a part, according to your plan, but you should go through that kind of hierarchy that the county wants you to go through in order to before you ask for assistance. So they're anticipating that you would, one, look for the locations and the transportation yourself. If you don't have the ability to do that, you would rely on your MOUs or your agreements with other providers or with other companies. And then if those are expired and you can't do that, then you would go to the county and you would ask them for assistance with that. All that needs to be actually be physically done during the exercise. So it's actually doing the process of that. But if you're going to do evacuation, it goes beyond just that. It's thinking about all the medical records that need to be printed off and go with the people. It has to, face sheets, everything. It's setting up a staging area outside your building and thinking about where the ambulances are going to come in or where the paratransit's going to come in. Think about, are they blocked? How many can fit within there? If you're calling for ambulances and 50 show up, could 50 fit in your parking lot? Probably not. Where are you going to stage them as you evacuate people? All that stuff needs to be kind of thought out and walked through during this full-scale exercise. So I know it's a lot of work. It sounds like a lot of work, and it is a lot of work. No joke. It's if you think about it in terms of what would happen in real life, a full-scale exercise is supposed to mirror those actions. So as we do it, even though it's not a real event, they should look like you're managing a real event. Did you have anything else on the back?
No, we have plenty of sort of like checklists and things for evacuation. If you go to our website, cahf-disasterprep.com. Yeah, it is really overwhelming. I think evacuation is definitely the more involved function than sheltering in place.
And right. I mean, realistically, you could say we're sheltering in place and our operations are not impacted, but we have no open beds and we're not doing anything, right? And then you're just going to practice getting information from the county, practicing passing information back to the county, and doing a review of your internal supplies, and then doing and having somebody monitor information for situational awareness to determine if you have to change from shelter in place to evacuation. That could be the smallest kind of version of this. And then you can expand it out to, evacuation of your entire facility. Obviously, if you're going to do evacuation, my recommendation is to not make it as as non-disruptive as possible to the residents. And so if you're going to simulate like moving people out in wheelchairs or gurneys or things like that, do it with an empty wheelchair or an empty gurney. Or if you can get people to come in and be fake victims, you could do that. But I would say a lot of people will get a wheelchair and just tie a balloon on top of it, to it. And so you would have 5 wheelchairs with balloons tied to them, and those would be the wheelchairs you would use for the exercise. Just a thought.
Yeah, and it's probably a good idea as well to announce or put up signs that you are going to be holding an exercise.
100%. Yeah.
And I think we have a bullet on that at the very end of this. But yeah, so again, if you go to our webpage for evacuation or shelter in place, we've got some checklists on there. Should make it a little bit easier. Oh, and we have a few more tasks that you could do for evacuation. These are all just examples, or you can, do all of these. So the expectation when you're putting together your exercise is that you would pick at least 3 of these objectives, and then these bullet points underneath fall under each objective. So you'll have a lot of different activities going on. So again, just thinking ahead about who you could assign some of these things to, or if you could even do some of the stuff ahead of time about checking the supplies and all that good stuff. And then also, I know that we have our October 24th training coming up, and so hopefully we can take a few minutes on that day just to revisit the idea of memorandums of understanding. Hopefully people in the room will take advantage of getting to meet other providers and start building stronger relationships for some of these potential evacuation to surge scenarios, because it will eventually happen. And like Jason was saying, it's going to be pretty challenging when we have a large event. I think after Northridge, there was something like 40 facilities that had to completely evacuate. And that also takes out a large chunk of available beds from the county as well. So it's kind of a twofold problem and something that we could definitely improve upon. Okay, our last objective here. So this is kind of about recovery and mental health. So the objective is at the top there, plan for the activation of mental and behavioral health for all staff members as part of incident response and planning. So you can request medical health support from the county. This is kind of like their newest initiative. It's been around for a while, but they have a lot of resources available that you can bring out to your facility.
And because all of these exercises are written under grants, they give us targeted these specific things that we have to exercise, and this is one of those things: is mental health during disaster operations. That's very it's the soup du jour, basically, for disaster preparedness right now. A lot of people want to talk about psychological first aid and things like that and taking care of each other. In this particular exercise, we didn't write a bunch of stuff in there for mental health. When we're talking about these exercises, we're talking about the first 4 hours of activation of an event. And it's unlikely that we would have access to mental health resources that quickly during an event. But because the feds want us to write in there, we had to write an objective for that. So what we did, when we go over the MSEL or the master scenario events list in a second here, we'll talk about quickly about how you would meet that objective if you want to do it. So let's.
Yeah. Just a quick note, because I don't know if we'll be able to get all the way to the end of when we'll revisit this, but we do have some toolkits for psychological first aid specifically for this. So again, if you visit our website, we have a training video. You could do some of the role playing that's in that training video and incorporate it into your exercise at the end. I know that exercise probably will be stressful in itself, so you could do PFA to your own staff
Yeah,
about the exercise.
Yeah, PFA as a part of the debrief afterwards, for sure.
Okay. So this is what our first screen cap of the MSEL looks like. So I put all the page numbers along the bottom here to try and make it as easy as possible to follow along. So this is kind of a couple days leading up to the exercise. And this document kind of captures all of the different provider types for the exercise. So personally, I think it's a little bit confusing. I'm a very visual person, but spreadsheets kind of make me go cross-eyed.
Yeah,
so.
and I don't know if anybody, including the people that work on the exercise work group, think this is a perfect tool. But it's when we were trying to pass out information to so many different provider types, I guess it's the easiest way for them to do it. But as you read this, on the column on the left where it says inject, that's kind of a numerical listing of how things happen in a chronological order. So from the beginning to the end of the exercise, that's kind of the flow of how events are going to happen. These first kind of 4 injects are all for everybody that's participating in the exercise. And so when we mean everybody, I mean everybody. County officials, city officials, fire departments, hospitals, nursing homes, hospice, dialysis, intermediate care facilities, you name it. This is meant for all of them.
Right, and so the way to read this is, let's see, I'm going to try something new here. I'm going to see if this will let me draw with a pen. So under the column for objectives, when we get further in, we'll start seeing where it will say like LTC1, LTC2, and that corresponds to the objectives that we just reviewed. And so as you go through the document, we are going to focus on just the ones that are for long-term care or for everyone. Yeah. So your document's going to have a lot of stuff in here that you can honestly just cross out. That was our activity at the participant seminar last week, was to cross out the things that do not apply to your sector. And so that way everybody kind of got to go through it. So for this slide here, this is kind of them just setting the stage and kind of ramping up this imaginary heavy rainfall. I say imaginary because it's LA, but you guys do,
Well,
it's crazy out there now. So
yeah, you don't realize that flooding is a really common problem in desert communities, and Southern California is a desert, and we get a large amount of rain in a short period of time. It's not like Georgia. Georgia could get 10 inches of rain in a day, and it's nothing. If Los Angeles got 10 inches in a day, it would be catastrophic. So even though we talk about flooding in Los Angeles, people think, oh, that's silly. Why would we do that? But the water's got nowhere to go.
yeah, Lonnie Easel from Public Works, her presentation was really great because she talked about the historic flooding, and I guess like back in the late 1800s, Long Beach was like under 6 feet of water, so it's definitely very possible. So anyway, we won't get too much into backtracking here.
Yeah, I don't want to build if it applies for you, flooding, that's great. If it doesn't, practice your shelter in place and your ability to assist other providers.
Right. Oops, and now let's see. Bear with me here. Whoop.
Can you just press it down there?
There we go. We're on track now. So again, you can kind of see how the time is progressing. Over here in the description, things are getting progressively worse as far as transportation goes. It's starting to say that schools are being closed. So whenever you see anything about schools being closed and childcare becoming an issue, then you know that you're going to start having impacts to your staffing.
Yeah, more than likely. And you see that red asterisk slide, that's where we covered all the people that you're going to need to participate in the exercise. So players are the people that are going to be doing the actions. Controller is going to be the one running the exercise, and the evaluator is going to be the person that sits to the side that takes notes on the actions that everybody's doing.
Right. So reading this chart here, so inject number 6 at 8 a.m., we know that everyone that you've decided that's going to be part of your exercise should be ready to activate the exercise and receive a briefing of the scenario. So at 8 a.m. on Thursday the 21st, you could inform your staff kind of these things right above here about the flooding and the delivery drivers not having access, et cetera, et cetera. And then this is when the exercise actually begins at 9 a.m. And so that's when, well, hopefully you are already logged into ReadyNet, but that's when you can start expecting there to be some notifications or some alerts going out, and wanting to keep an eye on it or assign someone to keep an eye on that so that you can be as active as possible during the exercise. And I think the exercise is only like 3 hours long. I think it wraps up at like 12 p.m.
It's 4. It wraps up at 1.
Oh, it does at 1 p.m.
I think so.
So, well, it starts at 8 a.m. technically. But anyway,
well, we had disputes because some people don't get to work at 8, and they were like, "Oh, I don't get to work before then." So,
oh, okay. Well, whenever works for you at your facility.
Yeah, and you don't have to stick to that timeline. You get to pick whatever you want. If you want to do a different timeline, essentially, it just needs to stand out for. It needs to go for 4 hours. So.
Right, and so this one here, this doesn't have long-term care stuff in it, but this is again just kind of developing, so you can see how the county is kind of ramping up all of their operations as well. And then this line here for number 11, all players. So some of the cities are activating their emergency operations centers, so this is kind of your cue to
coordinate with your city.
Right, for those non-medical requests.
Right, if your city's participating. Like I said, I know Long Beach is. I'll have to get a list of the cities that other cities are doing.
Right, and so if you have already decided that you're going to test your staffing and simulate like a staffing shortage because maybe the freeways are flooded, and you want to request transportation, then this would be something that you could start doing as well. Also, just remember, as when you're coordinating with outside agencies or stakeholders, putting "this is an exercise" in all caps before all of your correspondence is best practice. Yeah,
don't send them something that says "I need to be evacuated."
Right. So again, there's no such thing as overkill with putting "this is an exercise" on everything you do, and all those signs that you're hopefully putting up around your facility. Okay. We'll go ahead and.
So this is an example of where we would list out on the objectives. You see all those categories: ASC, dialysis, hospital, yada, yada, yada. the long-term care on the bottom, it says LTC 1 and 2. So that particular inject is meant to test those objectives, the objective to activate your emergency operations plan and to communicate with the response communities. So you can go on to the next one. I want to try to get this
Okay.
within an hour, I know.
Oh, that's weird. It stays on there. Well, sorry, everyone.
At 9:20 is when you're, talking about sheltering in place or evacuating, and the TJC and CMS healthcare stuff is just as it relates to your specific requirements. So for long-term care, it's sending that information to DHS through the MAC, and letting them know whether you're sheltering or whether you're evacuating. All right.
This next one, this is just answering the bed availability poll on ReadyNet. So you can expect the first ReadyNet bed poll by 9:30. So if you want to go ahead and schedule yourself for that time to be available, I think that would probably be a good way to go about it.
If you're already logged into ReadyNet or you log in before then, you don't have to wait till 9:30. If you're already logged into ReadyNet and you're activated and you're ahead of the game and you have the ability to help out, put your information in. So
okay, so let's see, at 10:15, let me get this out of the way there. Oh yes, so this is our other red asterisk. So this one wasn't originally for long-term care, but so imagine the hospitals are doing press conferences and all the response agencies are doing press conferences, but there was this blurb in here about your social media and how to spread information about your facility status. So we just wanted to highlight this because you might want to incorporate your social media or posting something about your exercise so that your residents' families can see that you're engaged. That's probably a good way that you could highlight your exercise program.
But review your policies and procedures about when you're going to notify family members, because that's another thing that we did not mention in the communication portion, but it is a requirement, is to be able to have the ability to notify family members in the ombudsman's office of your activation and where you're going, whether you're sheltering or evacuating. As a best practice, what we've seen in other areas in real disasters, that's the easiest way to pass out mass information to people when your communications are impacted. So maybe you're evacuated out of your building already and you need to pass information on how to get a hold of you. You could post that up to your social media page and say, hey, we've been evacuated. If you have questions or concerns about your loved one, please contact this number. And you would have a separate number for your cell phone or something like that, or somebody that's dedicated for that. But it's just a prompt to look at what are your procedures for disseminating information to resident family members and the ombudsman. I don't think it's likely that you'll get media requests, but if you do in these large events, look at what your procedures are. Do you have something in writing as to what you're supposed to do, or do you have an idea or a concept of how you would address that? And if not, defer that stuff to the medical alert center or to the county and say, we're not going to give a public statement. We're going to rely on that of the county officials.
Okay, we're going to try and get through the rest of the slides as quickly as we can, and then I see that we have one or two questions, so bear with us here. I know that this is a lot of information for 1 hour, and we got a little bit of a late start. So this slide here, this is where we see that you're going to have to choose whether or not you want to shelter in place or evacuate. And hopefully you've already kind of decided which one you want to do. You can, play to your strengths if you know that you want to practice sheltering in place, or if you want to challenge yourself to really test your MOUs, you can do evacuation. And then this one, let's see. So this is our slide for, again, just revisiting that idea of medical resources versus non-medical resources. Who would you send those to? So again, medical would go to the MAC via ReadyNet, and non-medical you would want to send to your city emergency operations center. If you get them mixed up and you send non-medical to the MAC, it's not the end of the world, but just anticipate that it might take a little bit longer. So if you realize your mistake, just go ahead and resubmit it to the correct one. And let's see here.
And that last one, this is for the behavioral health. So
yeah.
one of the injects was like, how do we test this in the first 4 hours? Well, you can simulate that one of your staff members has lost their home, or maybe a couple staff members have lost their home as a result of the flood. And if that's the case, they're going to need help. Well, everybody's different, but it's possible that they could need some assistance. And so you can coordinate that assistance. Frankly, it's, if you guys have done the PFA class or are familiar with PFA, or you're a friend, you should have something like that set up where you could counsel each other. But in the case where you need a medical health professional, somebody's experiencing an event that you're not capable of dealing with, the county has the ability to send folks to you for that. So.
Right. And then our very last cell here, so inject number 52, this was kind of added on afterward, and so they're simulating Southern California Edison or the LA Department of Water and Power doing a power outage throughout the county. And so again, you can submit this information through a status update poll on ReadyNet. So when I was saying that there might be more than one ReadyNet poll going out, just anticipate that there might be a second one asking about whether or not.
Yeah, and I'll be frank. I thought that when you logged into ReadyNet, you'll have the ability to do this at the same time, but I'll have to confirm that. Gosh, I apologize, guys. I thought it would be a part of the same thing, and it may be two separate things. So we'll get that clarification for that, and then we'll address it in the next webinar before the exercise.
Yeah, but we do know there's going to be a ReadyNet poll at 9:30, and then there might be a possible second one at 12:30. So, and we'll recap this all again on November 6th and kind of discuss more about what the actual steps for engaging your staff might look like. Let's see. I'm clicking around here. Oh, we have more. This is kind of just all of the wrap up and all of the steps about debriefing your staff and kind of getting everyone's feedback afterward, and then making sure that you capture it in an after action report.
Yeah, and that number 55, that's a big one. So you guys have finished the exercise. Everybody's done. You're going to pull everybody back together, and you're going to have a debrief where you're all going to talk about what happened in the exercise, what you guys thought you did well, what you thought you might have weakness in, and that will help to determine the after action report. So, but if I can convince you guys to do anything after the exercise, you want to come up with a list of 3 things you need to correct and 3 things that you think you did really well. And that'll be the basis of what you do in the after action report. It doesn't have to be complex. It could be something as simple as correcting our communication plan to reflect the right phone numbers to contact these people. Or it could be something as complex as rewriting our entire evacuation policy and procedure to recognize specific things. So it could be small, it could be large.
All right, so that concludes our review of the MSEL, the Master Scenario Events List. Again, I apologize for these random squiggles that I somehow drew on there and now will not go away. Our next webinar is going to be on November 6th at 2 p.m. So after today, again, decide if you want to evacuate or shelter in place, review those policies and procedures, and then gather any additional information you may need. Check your emergency supplies and assign staff duties as much as possible ahead of time. And then think about scheduling extra staff if you're going to need someone to cover that person while they're exercising. Think about posting signs in the break room so that people have a heads up and can even volunteer if they really want to get involved. And then also think about signs for the residents and the visitors on the day of, or maybe even the day before or the week before.
Yeah, and if you get people that don't want to exercise, say, look, we'll have pizza party for everybody that participates in the exercise, and for those that don't want to do it, they don't get any pizza.
Yeah, so Jason and I were discussing if you take photos of your full-scale exercise, send them in to us, and we're going to come up with a prize for.
Yeah, we'll come up with a few prizes. I think
Yeah.
what we want to do is we want you guys to take pictures of your exercises so that we can use it for marketing material. Essentially, we just want to get people more jazzed about doing this stuff. And I know it's hard, and I know it takes a lot of time, but man, it really pays off after a real event happens. It really
Yeah,
does.
for our conference earlier this year, we wanted to do posters, but we didn't have enough posters. We didn't have enough time to get stuff like this from people and then turn it into posters. But that's something, if you do send in your photos, no pictures of actual residents, try and get people's permission before you take photos of them.
Yeah.
And then, yeah, you can send them in to us, and we're
I
gonna.
promise we'll come up with a good prize for the winners.
Yeah, we'll announce the official prize on the next webinar. So
Thank you guys. Thanks for
thank
your
you.
patience.
You can find this video on YouTube probably later.